Hi, I'm Tony Lamas. I'm the chief of the Columbia University Division of Cardiology at Mount Sinai Medical Center in Miami Beach, Florida, and professor of medicine at Columbia University Medical Center. And I'm the chairman of this scientific statement from the American Heart Association.
Hi, I am Anna Navas-Acien. I am a professor of environmental health sciences at Columbia University, Mann School of Public Health. And I am, by training, I am a physician, epidemiologist, and specialist in preventive medicine. And I am the co-chair of this AHA scientific statement.
Anna, this is a revolutionary idea, I think, for most clinicians that lead, cadmium, and arsenic are essentially cardiovascular risk factors. How long would you say that science has recognized metals as cardiovascular toxicants?
Evidence we have for more than 100 years. There was a landmark paper published in the British Medical Journal already in the late 1800s recognizing lead as a risk factor for cardiovascular disease. But I would say that more formally, with a really high quality epidemiological and toxicological evidence, this has been known now for the last 25 years with the recognition of the field of environmental cardiology.
And how long have you been involved in this cardiovascular focus?
Yes, also for more than 20 years. I started first in the field of environment and cancer, and then I became more interested in the field of cardiovascular disease prevention. And most of the work on prevention for cardiovascular disease was focused on lifestyles. So really there was an opportunity to advance the field in this area of environment and cardiovascular disease.
Can you expand a little bit on the epidemiological studies that have repeatedly associated metals with cardiovascular disease?
Yes, the epidemiological evidence is really robust, very solid, with studies all over the world. In the US, I would highlight the findings from the NHANES study, the National Health and Nutrition Examination Survey, very important study representative of the US population. And in that study, the three metals of this statement, lead, cadmium, and arsenic, have been associated with cardiovascular disease. The evidence is especially robust for lead, with a lot of substantial evidence over decades now in NHANES showing the importance as a risk factor for cardiovascular disease. And some analysis in NHANES have estimated that up to 450,000 cardiovascular deaths per year could be related to lead. So this is really remarkable. This highlights that lead and these other metals could be really important risk factors for cardiovascular disease. Now, Tony, I am going to ask you, and what do you think is the main take-home message, given all this epidemiological and toxicological evidence that we've reviewed in the statement?
Well, the fact that there are potentially 450,000 annual deaths in the US that are attributable to low-level lead intoxication absolutely is extraordinary. The take-home message, which I think it's important to start with a take-home message, is really that around the world, most people are regularly exposed to low or moderate levels of lead, cadmium, and arsenic in the environment, increasing the risk of coronary artery disease, stroke, and peripheral artery disease. And this is not widely known among clinicians.
Yes, and this is really important. And I think we need to recognize how people are exposed to these toxic contaminant metals. These are found in the air that we breathe, the water that we drink, and the food that we eat. And basically, we are getting a daily dose to a combination of these elements. And these metals do not really have a role in the human body. They are absorbed via the respiratory and gastrointestinal tract, and they are going to impact multiple functions and pathways in our bodies, increasing inflammation, oxidative stress, and also they remain in our body for decades, some of them, like lead and cadmium. So there is plenty of opportunity for vascular damage. But in addition to this, regular exposure, it's very important for us to recognize that there are certain population groups, especially communities with lower socioeconomic means, certain race ethnic groups that are really disproportionately exposed to these elements. So these environmental exposures are a source of environmental injustice in our society and provide an important opportunity to mitigate some of these inequalities in cardiovascular disease. So this is really important to recognize. But now, Tony, I wanted to ask you, in the writing committee, we debated quite a bit about what can clinicians do. Sometimes we feel, there is the feeling that this is an issue of public health, that, public health, public policy is what should deal with environmental issues. But what do you think clinicians could do?
As a clinician who sits across a desk from a patient, the truth is that trying to manage this requires public health measures, including exposure monitoring and abatement, individual testing, development of treatments for these accumulated metals. In fact, there was an NIH clinical trial published over 10 years ago showing that a reduction of cardiovascular events occurred after treatment to increase excretion of lead and cadmium. This medication is being retested in a follow-up NIH trial, but we're hopeful that newer medications and including simple things like dietary changes will show some benefit as well.
This is really exciting to think that we can have increased the tools available in cardiology to treat and prevent cardiovascular disease. This is really, really exciting, all these new treatments opportunities. But as I am a preventive medicine specialist myself, and I really focus on prevention, I really want to think about what we can do to reduce these metal exposures. And also, what can clinicians do to reduce metal contamination and patients, patients, people in the street who might be the people in our population, in our society, who are thinking, what can I do to reduce these exposures? So I think very important, first of all, to eliminate smoking from our lives and our society is one of the major sources of metals is tobacco smoke. So please do not smoke, and also protect yourself from tobacco smoke. Don't smoke in public places, don't smoke in indoor environments. If you have a well water, it's important to test your well, because there is no way to know what's in your well. There might be toxic metals in it. But in some communities, even though there is the community testing of public water systems, maybe some of the water doesn't meet the regulatory guidelines. So even in places, even with private wells or community water systems that are not completely safe, you might need to treat your water with some filter system, appropriate, adequate filters, so that you can remove the metals from the water. There is also the issue of air pollution. So air pollution is also contaminated with metals. So you may want to protect yourself from exercising on days that there is high air pollution, making sure your ventilation systems in your house are adequate. If you live, for instance, near a highway, that might be particularly important, or near a source of air pollution. And then you can maybe ask your doctor if there is some relevance for checking your blood or urine for toxic metals that might be in some scenarios adequate. For instance, if you have a child who is affected with lead contamination, pediatricians regularly check for metals in children. And so if there is if your child is affected, most likely you are also affected. So that's an important recommendation in some cases to test for these exposures through biomonitoring. And then I think, Tony, maybe you want to give us kind of the final conclusions from this work.
Well, again, the final conclusions really are that lead, arsenic, and cadmium are strongly associated with cardiovascular disease. And if you want to read about this in greater detail, and I hope that you do, we have an AHA scientific statement in the Journal of the American Heart Association, and the reference will appear after I finish speaking. And so thank you so much for your attention. And Anna, as always, thank you very much for your knowledge.
Thank you. A pleasure to be here for this important work, recognizing metals as risk factors for cardiovascular disease. Thank you.